posterior aspect of her thighs, which by the way is the most common area where cellulite is seen. The area that we're aiming to treat here is basically the one that I'm marking here. And here as well. So the first step is to cleanse the area with an antiseptic that you normally use in your clinic. You will deliver 0.2 mL roughly of product per injection point, okay? Using deep mesotherapy technique. Deep mesotherapy technique means that half of the length of this needle will be used. As you may know, mesotherapy can be also delivered as an intradermal technique, which is within the dermis, just creating small, papulas in the dermis. That is not a right technique for Alidya, okay? So I'm going to show that in a minute to show you what is the correct technique and what is not the correct technique. So, as I said, 0.2, which is roughly one of the marks, each one of the marks of the syringe. Because I have 10 ml of product here, I will use 5 ml on this side, 5 ml here. Okay, let's get started. Okay, I'm coming there. So halfway, inject, halfway, inject. Okay, that is the right technique. What is not right is if I do this and create. You notice that? I'm going to do it again. That is a dermal technique, intradermal technique. That is not the right technique for Alidya. You need to go deeper, approximately half the way of the syringe, normally in a 45 angle, and note how I'm pinching the skin with my other hand. You alright? Mm-hmm. If you're familiar with mesotherapy, you will be very familiar with what I'm doing here. We have used 5 mL on this side. Now we're going to complete the treatment on the other side. Okay, that's it. I avoided the area of her, the small bruise that she had here. As you can see, barely no bleeding at all. I avoided the visible capillaries on the surface. As I said earlier, it may be the case that she may get some bruises in the next days to come, but this is how Alidya is delivered.